Welcome to Quick Talks with Dr. Muse. Today we're going to be learning about opioids and opioid addiction. So I have here with me Dr. Dan Muse. He's an emergency physician from Brockton Hospital. He's been doing a lot of work with Oasis over the years, and he's going to share some information with us today.
Thank you, Stephanie. So this is part 3 of the series, and it's basically over what the opioids are. So essentially, we're going to be talking about addiction here. And one question you obviously might have, how do I know I'm having a problem with opioids? Or how do I know that someone I know is having a problem with opioids? And there's a lot of signs and symptoms to it. It's going to affect you physically. It's going to affect you emotionally. And so what you're going to see is going to changes in behavior, like anxiety and depression. You may change the way you interact with people. Typically, you'll start losing interest in what the things that really you loved in life, and start thinking more and more, quite frankly, about how do I get more drugs. You may become irresponsible. School typically will fall by the wayside if you are a student. Overall, you just sort of become sluggish. And one of the things you really have is a continuous craving for opioids. They will take, the need for drugs will take over your life. And with it, if you do not get these opioids, you will also suffer from physical withdrawals such as irritability, nausea, abdominal tightness, muscle cramping, even very symptomatic things such as diarrhea. So once the addiction starts, it will basically all encompass you. So what is an overdose and how does it work? Well, as stated in the other talks, we mentioned that it is going to affect your respiratory rate, and that ultimately is how it can kill you. Now, way over here, you have pain. Sorry about that. We shall go back. You have pain relief over here. You get a little tired if you get a little more. Then ultimately, as the amount of the opioids go up and up, you're going to start getting sleepy. Your breathing doesn't stop, but it slows down. You may become unresponsive even to stimuli such as somebody starts shaking you. Breathing will become minimal, and the last step before you die is you stop breathing altogether. The oxygen in your body is the gasoline in the car. If you don't have any gas in the car, it doesn't move, it doesn't work. And the same thing holds here. If you don't have oxygen, nothing else in your body is going to work and you'll die. So quite frankly, because of the epidemic that we are facing in this country with respect to addiction to opioids, we all have to be prepared. And unfortunately, especially in a state like Massachusetts, they have been extremely proactive in this area. And by that, there is groups that want to help you, whether they're police groups, EMT groups, social workers, organizations in your town, they're there to help you. But that may not be enough. And if you or someone you love or somebody you know and you'll be around has an addiction to opioids, Narcan should always be available. You don't need a prescription. You can go to your pharmacy. They will allow you to purchase it over the counter. And many groups actually will hand it out, such as Banzi Cope Center. So Narcan needs to be readily available. Don't look at this as a crutch. Don't look at this as saying, well, this is just enabling them to use opioids. No, it is to assure that they get another chance to get the help that they need. And always be ready to call 911. So don't keep it to yourself as well. If you feel that you are heading down that pathway or you're there, talk to your doctor. There are also multiple organizations out there, Mass Substance Abuse Hotline, family and friends can help. And if you're a student, go to the guidance counselor, seek out the teacher that you trust, the school nurse, the athletic trainer, your favorite coach. You can't do this alone, so get the help. And another source that's there for you is StoughtonOasis.org. Feel free to contact them in any way if you need some help and resources. Thank you much for your time.
Thanks again, Dr. Muse, for helping us put together this short series for some community education. We really appreciate it. And I hope everybody stays well. Please reach out to us if you have any questions. You can find all of the contact information for Stoughton Oasis on our website as listed here. Take care.
And thank you very much, one and all. Take care.